This is Damian McNamara reporting for Skin and Algae News Digital Network, reporting from the South Beach Symposium in South Florida. And with me is Dr. Joel Cohen, who is going to be here to talk to us a little bit about cannulas and give us an update. Now, Dr. Cohen, these use of cannulas for soft tissue fillers, you've known about that for years, but it's getting a lot of traction, a lot of attention lately among dermatologists. Can you address that?
You know, these have been actually pretty popular in Europe over the past several years, but it just seems to be gaining a lot of momentum in this country, and some of that really stems from the European experience. At IMCAS a few years ago, it was reported that in general use, people use it in Europe quite often, in Asia. So in particular, I found it helpful to be used in the cheek, in the infraorbital area, also in the deco and the dorsal hands. So the idea of using a cannula allows us to use a fanning type of injection pattern where we actually make one puncture into the skin and fan out in different directions. And previously there was an article that was published in Derm Surgery that suggested that fanning actually had an increased risk of bruising, which kind of makes sense. You're hitting in multiple different areas and you're probably encountering a vessel in that time frame. So by using a cannula, the thought is that hopefully we can encounter an area of a vessel and perhaps tuck under it or above it and avoid it, and therefore not get the bruising and bleeding that can be seen otherwise. So I think fanning has allowed us to address certain areas and to fill certain areas. It is a useful technique, and cannulas have actually helped me get better results with less bruising in my practice. Some people have actually found that people get less pain as well. So I recently, after using this over the past couple of years, I recently wrote up an article in JDD with Josh Eichner, and the patient that we actually feature is my mother-in-law. So I took a picture of my mother-in-law in clinic, and we changed and modified the picture to show a needle on one side versus a cannula on the other, in particular areas where we encounter vessels like on the cheeks. And now this was actually on the cover of JDD in January, so I have to admit my mother-in-law is now a cover girl.
Okay, and you got good feedback from your patients and your mother-in-law regarding this?
Yeah.
Okay.
So now I'm ready to try it on my mom if it works for my mother-in-law, but never in the reverse order.
Right, you got to be careful. You need a protocol. You got to follow the protocol. Okay, so is there any sort of general advice you have, caveats, benefits for dermatologists who want to start using cannula?
You know, first is I don't think cannulas are necessary in all areas, and second, you want to make sure that you're using an FDA-approved cannula. There's a couple companies right now that have approval to use in the US, and that's Dermasculpt and Magic Needle, and there may be others. And really start out where you're using something like a 27 gauge cannula. So you first make a nick in the skin with like a 25 gauge, so it's a little bit bigger opening, and then you put in the 27 gauge cannula and you kind of fan it out. And one thing I've actually found to be helpful is I put the 25 gauge needle into the skin, and then I pinch the skin, and I have my assistant take it out as I'm pinching the skin, and then I insert the cannula into the area, and that way you can precisely identify the area that you put the little nick in the skin rather than sort of fumbling around and a little bit of bleeding to find it. So it's really a helpful little trick that we've incorporated into the office.